Hello, this is Dr. Marshall here at Medical Specialty Clinic. Thanks for tuning in. Just wanted to talk a little bit about weight loss programs, weight loss options that we have here at the clinic. Little disclaimer to get started. Of course, this is not medical advice. This is just a general discussion about things. Before you start any exercise, weight loss, diet plan, always discuss that with your healthcare provider, and just to make sure that it's safe for you. As doctors, we make decisions on an individual basis, not as a group. So please discuss any of these options with your doctor. And as usual, if you would like to see us and discuss it, just give us a call and make an appointment. I'll put links to our website, our phone number that you can get in touch with us, email, those kind of things in the description. I get a lot of questions about weight loss. What can I do to lose weight? How can I go about it? Things like that. Obviously, people always try different diets. As far as diet goes, that is the foundation, obviously, and there are several good options. Anybody that knows me knows that I really like the keto diet. I think it's a very good diet for most people, not everyone, but I do like the science behind it and why it works. And basically how that works is it lowers your insulin level so that you can access fat to be burned as fuel. And you do that by decreasing your carbohydrate content and increasing healthy fats in your diet. So that is a good diet, but certainly not the only one. There's obviously other good diets. Weight Watchers is very good. Studies show that people maintain weight loss well after they stop doing the diet. Another diet is the Heart Healthy diet is very good. And then there's a diet called the DASH diet that is also very good. There are also special diets if you have kidney failure. There's a renal diet and then heart failure diets, things like that. The American Diabetes Association has several recommendations on diets. I'd encourage you to go look at their website, get some recipes, things like that. In general, it's a combination of foods that causes problems, and it's a combination of those macronutrients. The three macronutrients that we put together that we worry about are proteins, fat, and carbohydrates. So those are the macros. When you hear the word macros, that's what they're talking about. How many grams of carbohydrates, how many grams of fat, how many grams of protein are in your food. I do want to mention that usually high protein diets are not healthy. So it just increasing your protein content, eating all meat, things like that, that is generally not good, but there are certain cases where it could be applicable, but most of the time, a very high protein diet is not healthy. Beyond diet, what can we do? Well, there are several different options. There's a lot of medications out there. I think the most common medication that we mentioned would be Phentermine. So as far as diet, prescription medications, assistance for diet, I can break those down into two different groups. There are pills that you can take or injections. So there's some medications that get injected either into the muscle or just under the skin into the subcutaneous fat. There are basically those two groups, so pills or injections. So as far as pills go, by far and away the most commonly prescribed medication for weight loss is Phentermine. Another name for it is Adipex. And that is simply a stimulant. So it improves or increases your metabolic rate, increases calorie burn, decreases hunger. You have to be careful, especially in the summer, that you don't get dehydrated. You want to make sure you drink plenty of water if you take Phentermine. It can increase your heart rate, can increase anxiety, make you more irritable and jittery. So those are kind of the common side effects from that. Again, discuss that with your doctor before you start that, but that's probably the most common medication. And then because we want to focus on decreasing your insulin level, if insulin is around, your body tends to want to store fat rather than burn fat. If you get that insulin level down, then you can access that fat to be used as fuel and burned. If we keep your insulin level down, it helps you lose weight. So a lot of the diabetic medications, not all of them, but some of the diabetic medications can help you lose weight. And Metformin has been used to help with weight loss, although the results are really modest with weight loss from Metformin, but it does improve insulin sensitivity. So the insulin that you do have works more efficiently, and it also, unfortunately, can cause some GI upset, some nausea, and some diarrhea if you take it, and that may be most of why it helps with weight loss. But if it's mild and it helps you lose weight, then that's not really a terrible trade-off. Most people tolerate metformin fairly well. It is what they call an endocrine disruptor, so it can affect the endocrine system a little bit, and sometimes people don't like to take it long term. Although if you're diabetic, metformin is still one of the first medications that you like to try. There are a few others coming out now that are newer that would be first choice if they were cheaper. So anyway, I'll talk a little bit about those in a minute. Another medication that's been used to help with weight loss would be Topamax or Topiramate. So that is actually a seizure medication that can decrease hunger. It is not used very much now. It's kind of fallen out of favor. Studies didn't show a tremendous amount of weight loss, and of course it has several side effects. So Topiramate or Topamax would be another option. Bupropion or Wellbutrin. That medication is an antidepressant, and it can help with ADHD treatment as well, and smoking cessation. It decreases cravings for food, things like that. So it can help with weight loss, probably helps with metabolism, maybe through some hormone effects. But that is another medication that you can try. And if you do, I would recommend the smoking cessation dose, which is typically 150 milligrams of the extended release taken twice a day. Then another medication that we've started to use some now to help with weight loss is Naltrexone, specifically low-dose Naltrexone. So Naltrexone is a medication that's been around for a long time, and it's actually an opioid receptor blocker. And so you might ask, why would you want to use an opioid blocker to help with weight loss? And the short answer is we don't know exactly, but it has several effects on craving and compulsive behavior, things like that. And it's also approved to treat alcoholism. So it's FDA approved to treat alcoholism. It decreases the drive and urge to drink. You can take low dose naltrexone, so doses lower than you would need to treat alcoholism or to reverse an opioid overdose. You can take lower doses, and it decreases inflammation, decreases cravings, things like that, suppresses appetite. And we use quite a bit of that because it's very safe, usually very few side effects, if any, from that. It's also cheap. So it's compounded here locally. We've got a pharmacy in town that compounds the low dose form. And so it's very affordable and can help. So that's another option that I always like to mention to patients. Then there are medications like Alli, which is actually over the counter, and that blocks fat absorption is the way that works. So you just have less calories make it into the body to get stored. Problem with Alli is that it causes a lot of diarrhea, a lot of GI upset, cramping, things like that. So it's not used a lot, but it is something that you can use if you watch what you eat, which is always a good idea on a diet and weight loss plan, is to not just eat whatever you want to. You really have to put some kind of limits on your foods and your meals. So Alli would be another option. So that is it for the oral medications. And I'll try and post a list of the prices from GoodRx. You can have some different options depending on insurance coverage and prescription drug coverage, but I'll list some approximate prices from GoodRx on these medications. So then that takes us to the injections. Injection meds for weight loss, there are only a couple right now. One group is the GLP-1 affecting medication. So GLP-1 is glucagon-like peptide. So glucagon is kind of the opposite of insulin. So insulin makes you store calories as fat. Glucagon is the hormone that you release when your sugar gets low. I won't go into exactly how these work. The mechanism is a little complicated, but basically they improve insulin sensitivity by slowing down how fast the stomach empties out. They decrease glycogen or sugar production from the liver and help in that way. So these medications are usually well tolerated. The original Liraglutide or Victoza or Saxenda, that's Sazenda, those injections are once a day. Well, now they have an injection of Semaglutide instead of Liraglutide, and it is a once a week injection. Much longer half-life, lasts a lot longer, so you only have to take it once a week, which is very nice. Although it's new and it's still very expensive. And some brand names for that are Ozempic and Wegovy. So they also make an oral form of this medication, which is kind of a new thing. Most of the time these medications have to be given and bypass the stomach and the liver, but they have come out with a form of semaglutide that you can actually take by mouth, and that is called Rybelsus is the brand name for that. Obviously, it's brand new. It's still expensive. There are some coupon and rebate programs and things like that the manufacturer has, but a lot of times insurance does not cover that for weight loss. But these medications are diabetic meds that can be used for weight loss, and Saxenda, that brand name of Liraglutide, is approved for weight loss, just like Wegovy is approved for weight loss with Semaglutide. That's the generic name. Those are a couple of injection options. And then there are also weight loss shots, which are typically some vitamin B12. Used to use HCG, although that has been regulated a little bit differently by the FDA, so there's not a lot of that anymore. Some other B vitamins and some amino acids like inositol, carnitine is one that can be used. So there can be a different variety of these. The one that we offer here at the office is Lipomino. I'll put a link to that video that I talked about what is in that and how that works. So that can help a little bit, stimulate your metabolism, help with cravings, things like that. And then there is one more injection that some people use. That is Sermorelin, Sermorelin. So it helps stimulate the brain, the pituitary gland, to release a little growth hormone. And it doesn't increase this dramatically. It's a mild effect, but increased growth hormone can help with improving muscle tone, fat burning, actually can help you sleep better, things like that. So it improves your metabolism overall, but this again is a mild effect. This is not like getting a shot of actual growth hormone. Few side effects from that, but typically decreases appetite, increases metabolic rate slightly. And again, you put all of these together and it can help you lose weight. But please don't forget that changing your diet, decreasing your calories, decreasing your carbohydrates to keep that insulin level low is really the foundation for a good weight loss program. And eating healthy foods, fresh vegetables, things like that. Fruits are okay, but they do have a lot of sugar in them. But nothing wrong with fruits, but you don't want to overdo it with fruit. Hard to overdo it with broccoli, cauliflower, asparagus, Brussels sprouts, zucchini, cucumber, squash, things like that. Those are good. Fruits and berries are okay though, again, not a problem. Just be mindful of the sugar in them. And then healthy meats, lean meats are going to be good. Nothing necessarily wrong with beef, but pork is going to be a little better, and then chicken and turkey are good options. Lamb is an excellent option if you can get it, and then fish would be the best. So, salmon, got the fish oil, the healthy fats in it. Healthy fats are good. So, believe it or not, eggs have some healthy fats in them, and mayonnaise is a good source of fat. Organic mayonnaise would be the best option, obviously. So don't discount mayonnaise. It is not bad for you. But the best fats are going to be the omega-3s, so fish oils, and then your monounsaturated fats like olive oil and coconut oil, medium chain triglycerides from coconut oil. Those are going to be much better for you than most of the other fats. Certainly better than the quote-unquote vegetable oils and things like that. So, and then butter is not bad. It's in the middle. Grass-fed butter certainly has a little better fatty acid profile. So that's just a little information for you on some ideas for weight loss. Oh, and for healthy fats, nuts actually are a really good source of fat. So walnuts have a precursor to omega-3 fats, so they're very good. Almonds, pecans, macadamia nuts, Brazil nuts, they're going to be good for you as well. Just something to think about. I hope this helps. I hope you found the video useful. If you did, please like and subscribe, and we'll see you in the next one. Thank you.